Myths and facts about breastfeeding. All mums have to clear up some common myths and misconceptions about breastfeeding that might help mums to get one step closer to a successful breastfeeding experience. Breastfeeding can help you shed body weight. Mothers who breastfeed burn about 300 to 500 extra calories a day. And research shows that they do tend to return to pre-baby body weight faster. In the early days, breastfeeding releases hormones that trigger your uterus to return to its pre-baby size faster. It's nature's way of helping new mums feel more like their pre-baby selves. The flip side though is that breastfeeding mums tend to have an increased appetite. If you are keen to lose weight gained in pregnancy, hold off on dieting until after 6 weeks. Breastfeeding makes your boobs sag. Pregnancy is what changes a person's breasts, not breastfeeding. So, unless you're one of the lucky ones with great genes, gravity will get to all of us mums in the end. It is normal to have challenges. Many women worry about whether their baby is getting enough milk, if they are doing everything right, how often baby should feed, baby maybe not latching on properly, and the most common issue is breast and nipple pain. Thankfully, most issues can be sorted within the first few days or weeks. It is important that women having trouble are given information on where to turn for advice. While there are peer support workers, breastfeeding support groups and online forums, support from family is hugely important. You can breastfeed after breast surgery. Many women with breast implants are able to breastfeed with no issues, as these surgeries often involve incisions on the underside of the breast that don't interfere with milk production or delivery. Women who have had breast reductions, on the other hand, may have more difficulty, especially if nerve endings around the nipple have been cut, but it's not impossible. If you are pregnant and concerned about the impact of breast surgery on breastfeeding, it is important to seek specialist advice and support. Breastfed babies are clingy and dependent. Children who are securely attached to their primary caregivers are more likely to be independent and secure in their relationships with others in childhood and beyond, regardless of feeding method. Babies whose early dependency needs are met by caregivers, who are responsive to their baby's cues and cries, are more likely to be able to grow secure in their own independence. Feeding in response to baby's cues, rather than feeding to a fixed schedule, for example, is one way to foster that secure attachment relationship with your child. It is a myth that breastfeeding on demand will spoil a baby or child, or that breastfeeding for any length of time will produce a clingy, dependent child. It is important to stay hydrated. It is important to stay hydrated, and not drinking enough fluids can affect how much milk you're making. Although drinking more fluids does not seem to increase milk production, drinking too little can reduce milk production. You have to stop when baby gets his first tooth. Some mothers decide that it's time to stop breastfeeding when they first notice a tooth. Usually this is because the baby has nipped the breast at the end of a feeding session, or because the mother fears she will be bitten. Yet many babies with teeth, or those who are teething, never bite when breastfeeding. An actively nursing baby physically cannot bite, because the tongue covers baby's lower teeth, in order to draw milk from the breast. A baby who nips the breast at the start or end of a feed often does it by accident, but if it is deliberate, because they love seeing mommy jump, they can be taught to stop. Formula is same as breast milk. Breast milk is a living substance constantly changing to meet baby's needs. It really is a superfood tailored to your individual child. It not only provides all the nutrition a baby needs, it also contains natural painkillers, fuels the baby's needs, to protect gut health for life, and supports a child's developing immune system well into toddlerhood. These living components cannot be replicated in a lab. Most infant formulas are primarily made from powdered cow's milk, with added vitamins and minerals, to meet basic nutritional needs. Infant formula does not contain any living components such as antibodies to help fight infections, no hormones or enzymes, and their proteins and fats are very different from those found in breast milk. So, those claims about one formula brand or another being closer to breast milk are deliberately misleading. If your breasts are small, you won't produce enough breast milk. The size of your breasts do not determine your ability to produce milk. Does breast milk lose its nutritional value? How long to give breast milk? Mother's breast milk changes as the baby grows to meet their changing needs. It always contains all of its protective properties and nutrients into toddlerhood and beyond. Around 6 months, babies will begin to explore solid foods, but breast milk should still form a significant part of baby's diet for months to come. The World Health Organization consistently recommends that children are breastfed until at least age 2, and continuing beyond that for as long as mother and child are happy to. Thanks for watching. Like, comment, share and subscribe. 5x Top Amazing Facts.